I think being a DPC, direct primary care doctor, means that you are your own business owner and independent doctor practicing medicine how you like it. This is Dr. Geong Lee, Jenny Lee, and this is my DPC story.
Welcome to the podcast, Dr. Lee.
Hi, how are you?
I'm doing so well. It's so exciting to talk with you. You're only a state away from me in Las Vegas. So hopefully someday we can see each other soon.
Yes, absolutely.
I wanted to start with your journey into medicine. What made you choose to become a physician?
Well, initially, I wanted to be a dentist because my dad was in the dental field and he looked up to dentists. So that's how my journey in medicine began. But I didn't really do well on the entrance exam. So from that, I kind of changed gear and took some time off and decided to go into medicine.
I did a post-bac program with dental students and medical students, and I could not do their upside down 3D, test, so to save my life. So
Yes.
I completely understand that. And in terms of when you found medicine as a better alternative that fit with you more, what was it that fueled your passion to go, full board into medicine and get into medical school?
I think that I always liked the idea of being able to help someone and being an advocate for people who could not really help themselves. And just the science itself interested me, and the path of medicine allows you to continue to learn. Not that you can't learn in other fields, but in medicine, you always have to be a student. And I really like that part.
And knowing that about you, in terms of before you opened Sunny Health DPC, what was your
Yes.
life like professionally?
I was 3 years out of my fellowship. I did a women's health after my family medicine residency. And I was an employed physician in a big outpatient clinic. It was my first job out of my fellowship. So I was in Las Vegas. This was the first place that I moved to.
And in terms of your day-to-day in
Mm-hmm.
this fee-for-service job, what were your expectations and what was your autonomy like at the time?
I didn't know I didn't have autonomy until it was taken away from me later. But I had a very busy schedule. I think initially I was seeing about 18 patients in a given 10-hour shift, but it really grew. And in the last year that I was there, I was averaging about 23, 25 patients per day.
Wow. And what were some of the biggest struggles that you found when you were having a schedule like that?
I didn't know there was a problem. Like I just thought I was doing a good job, and of course I was very busy. It was normal for me to miss lunch, kind of rush in, rush out, very busy picking up my children after work. But I didn't know much better. Like it was my first job, and I thought this is how all the doctors worked, and everybody around me worked that way. So I didn't really know there was a problem.
I'm sure listeners are thinking to themselves, that sounds really familiar. And, even hearing your words from my own experience, I know exactly what that feels like. It's like you go from residency clinic where maybe you're starting to do 99213s, 99214s,
Mhm.
and then you go into a clinic and like we've talked about those golden handcuffs, you start easing up your schedule. And then all of a sudden you have the schedule where you are not in control. And so I want to ask there, when you talk about you didn't know that you didn't have autonomy, what was that point where you were like, wow, this is not going to work for me to continue in fee for service?
Yeah, so that's how my schedule was. I was busy seeing about 25 patients per day, but all of a sudden they were asking me to change my schedule, see more patients, and all of a sudden change location, and I didn't really have much control over what they were telling me to do.
Wow. And was that because of the way your contract was written?
I think that, with the new management, because our company went through several transitions.
Gotcha.
And with the new management, they looked at each provider schedule a little bit differently. And when I was having some admin times built in before work and after work, before they didn't have a problem, but new management had a problem. And they said that I just needed to see more people.
What was the final straw that you experienced in fee for service that made you transition?
That's very interesting because if I didn't actually go to, I think the DPC Summit in year 2018,
Mm-hmm.
I may have been continuously working at fee for service office, But my husband and I, we were starting to get a little bit burnt out. So we're looking at other things. We're fascinated with DPC. So we went to the DPC Summit without much thought. And when I mentioned about the schedule change, those kind of things came after that. And when that happened, all of a sudden I thought, oh, I don't have to take this. I may have different options. So I think that's how it all began.
That's amazing. And, I am a big believer in things happen for a reason. So what a cool experience that you had that under your belt, the knowledge about DPC under your belt before you actually needed it. I feel that that's also very relatable because I was thinking about DPC long before I made the jump. So I love that.
Mhm.
And let me ask you there, when you talk about that you guys, I'm assuming you and your husband went to the DPC Summit. How did you
Yeah.
guys even find out about DPC?
I found out through my husband, but I think my husband found out through some Facebook groups. I think that's
Okay.
how it began. Yeah, most of us are included in the Facebook groups.
Definitely. And for those people who might not be on Facebook groups, for physicians, there are groups like DPC Docs, DPC Women, DPC Docs in the House, DPC for Newbies. There's lots and lots of DPC doctors groups, DPC Alliance, that is
Mhm.
another one. But I want to ask there in terms of, we are at the cusp of the two DPC summits this summer, the Hint Summit
Yeah.
coming up in June and the DPC Summit coming up in Kansas City. So can you tell people, what was your experience like when you were at the DPC Summit in 2018?
I've never felt that kind of experience before, because even though I was working professionally for 3 years, it was taking me a long time to get out of that student mode, because I've been student for so many years. And to see all these, experienced doctors kind of say, out on the stage clearly about what the problem is with the current medical system and what they did to transition, it was very refreshing for myself to hear it. And I thought that, oh, just because I'm a newbie, maybe this is how I feel, but it wasn't the case. And I saw that, the people who've been practicing medicine for 20 years actually heard my story, and I was able to relate to their story. And I think that was very special experience.
That's incredible. And I hope that the people who are able to attend summits this year, the in-person experience is so much different than watching recordings. And while I definitely
Yes.
encourage everybody to watch as many recordings or to
Mhm.
listen to as many podcasts as you can, it's very different when you're in the room with other people who are wanting to know more and more about DPC. So I definitely encourage people to check out the options when it comes to the summer and the summits. And when people are going to the DPC summits,
Mhm.
clearly entrepreneurship is a big theme in terms of DPC is a business model, and
Mhm.
we are physicians being able to practice autonomously through DPC as a model. And so I want to ask you there, when you had experienced this
Mhm.
corporation telling you, hey, you're going to have to change your schedule, goodbye admin time, we are going to we're gonna, make you work more for the same amount of money, and give patients less care. What, when you decided to open up Sunny
Mhm.
Health DPC, how did you get started? Did you take out a business loan? Did you fund it yourself? How did it work out financially?
So, I was fortunate because my husband was working as a physician, so we had a steady income. He could support the household. And I was lucky because one of my friend actually opened the direct primary care before me, about 6 months before me. And so he had an office space, very small, and he had 2 rooms. And he actually was, generous enough to give me the option to use the other room. So really, my overhead coming in was very low, maybe no more than maybe 1,500 per month. So I took out a small loan from my family's
Mhm.
account.
Yeah,
I
no,
took about
absolutely.
yeah, I took about $15,000 out, and really that's all I needed. Um, I wasn't making money for first 6 months, so but I wasn't taking any money away from the family's account. So the
Mhm.
only money that I took was $15,000, and later I paid it back after about a year. So that was really my starting budget. I didn't take
Awesome.
any outside loans.
Mhm. it's really important for people to hear that because, there are some people out there who think that starting a business, you have to take out a loan or you have to, go into debt for 20, 40, $60,000 or more. And when you are able to do things like network with people or hear people's stories as to how
Mhm.
they got started, just like you shared, you can hear the numbers to see if those numbers are something that can work for you. So
Yes.
15,000 as a loan from your family as your starting budget, and you were able to pay that back in a year, it definitely gives some people, some numbers to work off of there. And
Yes.
what an incredible, opportunity to have a DPC doctor to help you get started. It makes me think of when Dr. Belena Mott was talking about how she has the space
Hmm.
created specifically for other people who want to do DPC and
Yes.
for them to come in and use her space rather than having
Hmm.
to negotiate a lease, yada, yada, yada. So I think that's wonderful that that's how you were able to get, your space established. And
Hmm.
when you were in the transition period, about how long did you take between when you decided to do DPC and when you opened up your doors at Sunny Health DPC?
It took about 6 months. I
Okay.
took about a month and a half vacation between finishing my job. But I was in preparation while I was still employed, just kind of creating the website, looking at the logo, those kind of stuff. And yeah, it took about 6 months for preparation.
And when you were taking that monthish off,
Hmm.
what did you focus on at that point? Were you just, knee deep in doing DPC stuff, or did you take some time off just to relax and take a break from medicine?
Yeah, we just took a vacation.
Awesome.
We did a family vacation to I think we visited Hong Kong and Korea. My husband is Chinese and I'm Korean, so I think we just visited our relatives.
It's amazing. I want to say it was Dr. Van Slassie who talked about, taking time off is a good thing to think about. And, just
Hmm.
to have time to recover from the experience in fee for service
Yes.
is, healing to the soul. So that's awesome. And
Hmm.
let me ask you, when it comes to, like you talked about your logo and the name of your clinic, when did
Hmm.
you come up with those and did you create your logo yourself?
Yes, the logo I created myself. It is actually supposed to be like a person hugging, but it kind of looks like a heart and or an apple. But I did create that because I wanted to seem like, Sunny Health DPC is embracing, kind of like embracing a patient. The name came about because my mom actually had a flower shop when I was growing up, and it was a sunflower something flower shop. And she's someone that I really look up to, and she opened her business without much experience, and she really worked hard, and she did fine. And so I just wanted to have something sunny in there. So that's how the name came about.
It's so beautiful. It's so beautiful. And let me ask you because when you opened and you were in this shared space and you had your own business
Yes.
with your own logo, how
Hmm.
did that work with regards to sharing the space in terms
Hmm.
of did you have both DPC logos on the door or how did that work so that people might be going to the same location on Google, but they're two different
Hmm.
entities?
Hmm. Yeah. So that's where sort of like I had to match my price to be like my friend. I didn't want to have like lower price or higher price. We just kind of kept the pricing and the information pretty same.
Hmm.
Um, the building was like the lease was under my friend, so the name on the building like outside was his name. But I'm in the medical plaza, like medical building, so we never get like walk-ins. So people who will be coming in to see him or me, they will be coming in because they have a prior appointment. So I never really had a problem with that.
Nice.
Yeah, I just put like a like a little logo at the window,
Hmm.
like at the entrance door. But I didn't have any logos like outside the building. But after about a year and a half into myself practicing, we wanted to expand, so we actually got the next suite. So my name is now under the lease. So I share both spaces. My name's on both spaces. So now my name's at outside in the building and everything. But before I didn't. I didn't really have much problem with that either.
Gotcha. And what a nice way to experience, the business suite idea without
Yeah.
having to go, into your own lease to start again.
Hmm.
It's so great that that was how you started off space wise. And
Yes.
let me ask, in those early days,
Mm-hmm.
because, this is thinking back to when you opened, what were some of the challenges that you found unexpectedly going from a physician to then being a physician and entrepreneur?
You know, I don't think I'm a good entrepreneur. I I'm not very good at selling my business or my service, but I think that when people meet me number of times, they kind of learn to trust me, and I think that's been where I've been getting a lot of internal referrals.
Mhm.
But the challenge has been with like owning a business like this, where it's a membership base where people sign up and also sign off, right? um, I think that I wasn't easy initially, and even now, it's never been easy for me have people come and go. Like when
Mhm.
people like cancel the membership and leave, you know, I am it doesn't matter how many patients I have. Each and every time, it kind of makes me a little sad. It makes me wonder what did I do wrong.
Sure.
And I think that's sort of the challenge where operationally, like I need to kind of get over that because I have to understand that the business as medicine is also influx and people have to also leave, right?
Yes.
But having that, where there is, I was in general, my practice has been growing, but you know how there's been some hiccups where people cancel, people join, and that's been kind of hard for me. And I don't know how other DPC doctors see it when, but even now I said like it's very difficult for me to have a lot of patients. Let's say all of a sudden tomorrow, 5 patients canceled. I wouldn't think that, oh, these 5 people just had something else going on. It makes me wonder, like, was there something wrong with the practice? It kind of like I go back to that, and I think that's something I need to work on.
I appreciate that honesty because I'm sure that, churn is felt internally and emotionally by other people as well. And so I want to ask there, do you have some kind of exit survey? And what's your completion rate if you have an exit survey for those people who do choose to seek care elsewhere?
That's a very good that's a very good idea. I don't have an exit survey, and I think I should. I don't really have too many patients leave at once, right?
Mhm.
But in general, it's been like patients sometimes say they got insurance, and sometimes it'll be like they're moving out of town. I live in Vegas. It's a very transient city. So I've been having a lot of those reasons behind why patients are canceling membership. I haven't had too many patients leave in anger or had a real problem with the system.
And that's really good to hear because, when it comes to this is a business model, our value proposition has to make sense for people to invest in, their spending their money in our practices and in each
Mhm.
other as physicians. So I want to ask there, when you talk about Vegas
Mhm.
and the population,
Yes.
can you give us a little bit more of a feel as to, you're living in Vegas, you're not going to
Yes.
Vegas on a bachelorette party visit. So what is it like in terms of the demographics in your area and who has joined your practice?
I think that initially, like first, in early part of my business, a lot of my patients, although I never told my patients in my previous practice that I was leaving, they found me somehow and they joined my practice.
Mhm.
But afterwards, it was really word of mouth, and I put a small ad in like a Asian newspaper, and I did that because a lot of my patients who were Korean
Mhm.
and did not really ask me if there's a way for them to find me, and I say I don't know, but I will put an ad on the Korean newspaper. So they found me through that route. But I want to say in terms of demographic at this point, it's like any other city. Like I mean, we do have a lot of patients who is involved in service industries, and but people. I have patients who are just working in companies, businesses. Um, I mean, I have a small population of undocumented patients. I have patients who have. So I want to say it's pretty it's a lot. It's a big variety of patients, but I don't know if it would be much different if I was in the other city.
And in terms of when you look at, like you talked about that you have some people who have certain jobs, some people who are undocumented, the employed people, are there employers in Vegas who give DPC as an option to their employees who work in the service industry, like the people who are doing upkeep for hotels and properties and such?
I am part of like the Free Market Medical Association, and I hear, some information that there is actually talk in like hotel like companies, like big companies, where they may be interested in offering something like this. I'm not sure if they call it DPC,
Mhm.
but it's more like a membership model, like primary care options for their staff. And I
Gotcha.
think that it may be in the works, but I currently don't have patients from big companies who are under that kind of program.
In terms of the care for undocumented people in your practice, I want to ask, what is the draw when they say, "Oh my goodness, I'm going to go see Dr. Lee today and I'm going to sign up for her practice." What is the draw for them and that makes your practice attractive?
I think it'll be not just my practice, but all DPC primary care practices. They feel somewhat sheltered because they're not really having to go to the lab and do a blood test using their ID. They're there to show some basic ID, but they're under the umbrella of my practice.
Mhm.
So when they go in there, even to get a simple blood test done, they show whatever ID that they have, right? But it's not their insurance. They need to verify and check. It's really under my account. They're doing the blood test and prescription medication. As you know, it's not hard for them to pick up. So they feel somewhat sheltered. And if they have any questions, the thing is they could directly contact me and my staff. So I think that they feel more secure.
Wonderful. And thank you for sharing that because, there was actually a reporter who reached out recently because in California, I don't know how it is in Vegas, but in California, people who are undocumented over the age of 50 are going to be able to get Medi-Cal benefits. And great, but what do you actually get for Medi-Cal benefits? Like, how can
Right.
you access your primary care? How long do you have to wait to access your primary care, et cetera, et cetera? So I think those are wonderful points to take note of, especially if you are in a community who is
Mhm.
servicing undocumented people so that they can have access to preventative care just like anybody else in this country. So for those people who might have been on the fence initially and then later joined your practice, what was the draw that made them join at the end of the day?
You know, when I told you most of my patients are referred, and usually referral will come with an explanation from their friends or family about what happened and how Dr. Lee helped them. And I think that just experience like that, hearing about it, even though it didn't happen to them, kind of gives them the confidence to join the practice because they know, medically, they can't guarantee that everything's going to be okay every day. So I think, most people who understand, actually, it's interesting because people who have insurance seem to actually understand this concept and appreciate it as much as people who don't have any health insurance, because they know that even with their insurance, how difficult it is for them to get the care that they need. So I think that most people, when you explain to them, they understand. And really, when you do monthly times 12, and when you calculate how much they're paying a year, it really makes sense financially because it's maybe the cost of one-time urgent care visit.
Mhm.
So yeah, usually people understand that.
And when you talk about understanding, I want to highlight your FAQ page because on your website, versus like I think about like my website where my FAQs are questions, like what is
Mhm.
direct primary care? Your FAQ page is in statements that people who are looking for quality care could definitely be drawn to. So, for example, you have statements like, you don't want to wait for your doctor. Rather than a question like how often do you wait for your doctor, it's you don't want to wait for your doctor. And so I want to ask, when you were creating your website,
Mhm.
and creating your FAQs, I think that's a great way to
Mhm.
approach, the short attention spans that people have these
Oh
days.
yes.
And also speaking to their why, your potential patients' whys.
Mhm.
What was it going through your head when you created your FAQs to be statements rather than questions?
I think these are the things that I would like to hear if I was a patient. So that's how it came about.
So I think that, you said that you don't consider yourself a great entrepreneur, but I think that is so smart that you are thinking in your customer's eyes. So I love that. I love that.
Thank
And I
you.
hope that that's helpful for other people, especially those who are considering, their FAQs, in the next few weeks or so.
Yes.
And when you mention this 25 patients a day, and then you were asked to do more, in terms of your daily practice now,
Mhm.
what is your typical day at Sunny Health DPC?
So, uh, typical day at Sunny Health DPC is very busy. So, that's why I love your channel, because it's sort of like you give opportunity for entrepreneur, like, new doctors like me to, share the journey. And if I knew everything perfectly from the beginning, it wouldn't be much of a journey that you come with me, right? So I am someone who like to see patients very often. That's what I realized. So even though I don't have 2,000 patients in my panel, I find my schedules being kind of, very down. About 12 patients, about at least in a given day, on my DPC workday. And I think that's also too much, because 12 patients in my DPC practice, where typically I spend at least about 30 minutes per person,
Sure.
I I don't have much time. So I need to make some changes. Yes, but I do see about 12. But compared to what I had done before, like 25, this is much better.
Yeah. Awesome. And, when you talk about tomorrow, next week, next year might be different. I love that, again, highlighting the fact that you have the autonomy to make those changes and to pivot and reevaluate your practice and see what's working and what's not working. Recently, I had read about the ideal week. And so that's what I've been, using for my own practice with regards to pivoting and looking at what would I like to do? Because Marielle is not the best at keeping to her financial Friday plan. So I definitely would say, whatever works for you, for other entrepreneurs out there who are also physicians,
Yes.
taking a check-in with your practice every once in a while is a really
Mhm.
healthy thing, because sometimes life happens so fast, especially with an opening practice that's signing on patients so quickly,
Mhm.
that you might not have that time to take a step back and a breath. So I think I again appreciate the honesty there, and I appreciate your experience, because your experience, I'm sure, is very relatable to
Mhm.
other listeners out there.
Yes.
And when you talked about, I want to go back to um, the Asian newspaper ad that you
Yes.
took out. Now, is there a big Korean community in Las Vegas?
I think it's growing community, and yes, yeah, there is definitely at least medium-sized community, and there's been a lot of transitioning from, I think, people in other states moving here
Uh-huh.
in last couple of years. So, and included in that transition, I think definitely Asian, patients, Pacific Islanders, they're in the mix. I mean, many of them are transitioning here. So yes, the newspaper has been quite helpful for me.
That's great. And, when I think about when I was cleaning out my dad's house after he passed, the Bataan newspaper was what he had
Mhm.
collected, volumes of the Filipino newspaper. And
Oh
so
wow.
when you have a close knit community, especially if they have a local publication, whether that be digital or paper or whatever, even
Yes.
radio, it's definitely something to look into under
Mhm.
different eyes than you would, a big mainstream community based,
Mhm.
city based publication, because
Mhm.
more people within that specific concentrated community are most likely
Mhm.
going to be sharing the information there. So I love that. And, with you being Korean,
Mhm.
with you being able to
Yes.
speak bilingually in English
Mhm.
and Korean, I want to ask, because I'm sure you have patients who Korean is their first language and potentially their only language. Were those people able to find care from a Korean American or Korean doctor locally easily before you opened?
No, no, and that's really the main reason. And actually, that was one of my major reason why I even put the ad on the newspaper,
Mhm.
because a lot of my Korean patients in my old practice really relied on my service because I spoke the language. And I just wanted to let them know as an option, hey, like I am here, and if you really needed to find me. But no, there's not many Korean speaking physicians in Las Vegas. So it's been difficult for them to find care here. in terms of like a lack of care that they are receiving here, sometimes even for simple as upper respiratory infection or any medical concern, they would easily drive to LA, drive about 5 hours to get there just to get the care they need and drive right back. And this is not an uncommon practice here. And this is not uncommon practice, apparently only for Korean patients, but a lot of other Hispanic patients and a lot of other patients do that as well.
Sure. And yeah, with us being neighboring states, it does not surprise me because people drive, to Vegas so easily from California. I mean, it's 8 hours, I think, from where we are in Arnold. And that's, you can drive to Disneyland or drive to Vegas. And so for patients,
Yes.
To need care that badly, that they're
Mhm.
willing to drive that far to get
Yes.
quality care, hopefully quality care, that's just crazy. So,
Mhm.
that's wonderful that you have a niche of patients who
Mhm.
really will forever understand your value proposition because you're able to give culturally sensitive care. And
Mhm.
I want to ask there, coming up this June, you're
Yes.
also going to be involved with a seminar that is going to be hosted by the local Korean group. So can you please share about how you got involved in that and what is the seminar going to be focusing on where you're involved?
It's actually like a Korean community locally that reached out to me. And actually he wanted me to kind of start a dialogue with the Korean community, about medical issues, questions that local people have. So I thought it would be a good place for me to just kind of answer questions and kind of be available if they had questions about medical care. And so I agreed to it. I don't think it'll be just one time seminar. It'll be more like a series where I may be periodically called in to answer questions.
It's so cool. You're becoming your own local health expert, especially for the Korean community. So I love that. And it's I am also a big fan of this idea that if your patient doesn't join you today, they might join you, a week later, 2 weeks later, a
Mhm.
year later. But the fact that you're establishing yourself as somebody who they can learn from, who
Mhm.
understands them, I think that is never going to be anything but in your favor. So I think that's
Mhm.
awesome. And in terms of, you mentioned the Free Market Medical Association.
Mhm.
Can you tell us a little bit more about what does the FMMA look like in Vegas?
The Free Market Medical Association was just established really recently. And we had our first meeting like beginning of this year. But of course, it's an established group in other states. And we are trying to bring here like option for price transparency and
Mhm.
medical care. And we have scheduled meetings. We actually have a meeting that's scheduled coming Tuesday. But I think it's kind of also house all the direct primary care doctors in town so that we could start the dialogue and kind of pool all the specialists so we can provide some better care.
And that's what I was going to ask because,
Mhm.
when people talk about like BNI groups and whether it's helpful or not helpful for them, I was going to ask that about the FMMA in terms of
Yeah.
when you talk about being involved in the FMMA and just transparent pricing in general, how
Mhm.
have you been able to find specialists to care for your patients at cash prices locally?
We have like other direct primary care doctors in town, and I myself been practicing for about 3 years. So we actually have individually and as a group made quite a bit of connections with local specialists. So we do have most specialists that have cash pricing for us. So it's been really helpful.
That's really great that you're building out that network because you guys as DPC doctors do not discriminate against whether a person has insurance or not. And
Mhm.
to have specialists on board locally that you
Mhm.
guys are vetting yourselves, I think that's really powerful.
Yes, that's great.
And another organization you're a part of is the AAUW. So that's the American Association of University Women. And so this is something I had not heard of before. So can you share more about what the AAUW is and what's your participation in that organization?
AUW is, American Association of University Women, and it's really a group of not only females but primarily females, and they graduated university, And they have, they do a lot of good things in the community. We sponsor students for, scholarships. But there's sometimes like, drives, like for donation drives, things like that. So I just participate. The other association that I'm actually part of is Korean Chamber of Commerce. I am working as an acting secretary at this time. Um, it's again a new role for me, so there's not much that I have done so far, but they do have a lot of talks about bringing businesses from Korea, like convention expos, where I'm not where they'll be kind of hosting. So I'll learn more as time goes on, but I'm also excited about that role that I'm playing there.
Absolutely, especially, it's mutually beneficial for you bringing your entrepreneurship skills to
Mhm.
their table, but then learning from their space to help your own business. So I think that's really, really cool.
Yes.
Now, I want to ask about recently you have started delving into developing an aesthetics branch of your practice. So can you tell us about what made you get into aesthetics and how is it going adding that service on or adding that branch onto your DPC?
Yes, the first year into my direct primary care, I had some time, so I looked into some classes doing Botox and filler in the beginning classes, and I was really interested in it. I thought it was really fun, so really that's how it began, and I started taking more classes, and now I really have about 9 or 10 different services that I can provide in my practice. So I want it to be separate from my direct primary care. So I'm
Mhm.
in the process of having a separate practice that will be called Sunny Beauty and Wellness, where I'll be offering these services. But it's kind of like it's something different than primary care, where I could be a little bit more creative and I could be in my own space. So I really like that. So that's how it kind of came about.
For those people who might be interested in delving into aesthetics, what do you recommend in terms of how to start getting your feet wet when it comes to learning and improving your skills at aesthetics?
I think a primary care office is a great place for you to practice if you're interested in that kind of stuff because patients, first of all, trust you. So if you wanted to offer a very basic service, let's say like Botox, something basic Botox, you can do that in your office, and you have patients just regular patients walking into the clinic on in a regular day, right? So you don't have to do all the services. You don't have to open a med spa from the beginning, but you could kind of just, get your foot wet and just try and see if this is something you even like doing. But I would say that there's many classes that's offered in person. I mean, myself in Vegas, we have a lot of conferences here, so it's been really good for me. I didn't have to travel much. You could really pick any of those institutions for getting the training and try it out and see if this is something that you like doing. Financially, I'm not sure. Like at this point, I have invested quite a bit of money into my aesthetics. I can't say I have made much out of it yet, but I think that for me, it's a good investment. But everybody has to make the right decision for themselves.
And when it comes to aesthetics and offering aesthetics to your patients, do you have to, in Nevada, do you have to have a separate coverage for malpractice for aesthetics, or is it bundled into your physicians and surgeons coverage with your current company?
Um, if let's say, if you like, let's say for when you are doing like Botox once a month, I'm not sure if, you can ask your individual malpractice company, but I didn't. But now that I'm delving into more of a full aesthetic practice, I haven't yet. I haven't opened the practice yet. I have been offering some of the services. Then I think I need to expand my coverage.
Mhm. Yeah, definitely. I know that when I applied for my malpractice, that was a separate questionnaire in terms of, do you provide, I know aesthetics was on there, but also alternative medicine, I think was
Oh.
a separate questionnaire for my malpractice company. And when you look to the days that you're open with Sunny Beauty and Wellness, as well as with a panel of patients that you take care of at Sunny Health DPC,
Mhm.
how do you envision your pricing working for both your patients as well as your aesthetics practice?
I am going to raise my price. Why I'm going to raise my price will be what someone may be wondering about, right? Why at what point in your practice you may consider raising a price, right? And where are you in your practice? Are you full panel? Are you not? Do you, like, so like my business plan, people may be wondering about that, right? At one point, like, first, I think when I priced out, it wasn't much of a choice. Like, I just wanted to match what my friend had. Was more of a low scale on the pricing. I charge $20 for a kid, 65 for an average, 85 for 65 and older, right? But right now my panel is about closed. I mean, closed meaning I have about 400 patients, right? And I could take more patients, but this is the point where I'm trying to branch my other business. I told you, like, this is where I'm thinking, like, I'm not an average direct primary care doctor where I should be seeing 7 a day. I'm like, I'm overloading myself. I have 12 plus patients in my schedule. I have a problem, right? So in order for me to have aesthetic to kind of cool off and then own a DPC practice, I can't take all the patients. You know what I mean? So at this point, I have to make a decision, right? So I have patients on my waiting list. Of course, I could take all of them, but I've not done that. And actually, starting a waiting list has really helped me. I feel like all these people are starting to call. So I have, like, I don't know, 30 people on my waiting list or something like that. But then the thing is, I think I want to raise my price because I think that I can go up on the price. But the way that I'll be going up on my prices, I will leave my current patients alone. I'm not going to touch those prices. But really, the new onboarding patients who have the decision to join or not join, they're going to have to face whether they're okay with the price or not. So that's where I am.
When you talked about how you would like to keep your current members at a certain rate and then increase it for other members, it's definitely something that other DPC doctors have done. Other DPC doctors, just because of the price of materials going up, they'll increase their pricing for everybody, and everybody
Mm-hmm.
is different, and you do what's right for you. So I think that
Right.
that's great, but I love that you are at this branching point, considering
Mm-hmm.
what you're going to be doing,
Mm-hmm.
time wise with your own schedule when you
Yeah.
add aesthetics onto your thriving DPC practice.
Yeah. So, really, like, there's, like, I feel like everybody has a crossroad, and this may be mine, where I have an option to actually, somebody told me, why don't you hire someone? I never thought about hiring another doctor or having somebody work with me, right? But maybe somehow I never thought I'll hire a staff, period. But I hired the staff, right? So it's just kind of like there's like an increment of things, like, and it's good, but things that could happen where never say never. Like, I may actually have, like, year round, right now, if I was talking to you, Mario, I may actually have a doctor with me.
It's amazing.
I don't know, like, it's interesting, scary, but it may be, I'm at that point where I don't need to put people on the waiting list. I could have given it to a person.
And I just want to call out there, like, you're
Yeah.
saying these words, you're putting it out there in the universe. And so that might be the case indeed, where you have a
Maybe
second
someone's gonna call
physician.
me.
Yeah. Right after we get off this interview. That'd be amazing. You let me know if that happens. And
Okay.
and you mentioned, though, when you never thought that you would hire staff and then you hired a staff person, at what point did you decide this is going to happen because I need a staff person to help make sure that my patients get the care that they are wanting and deserving?
I, I was getting too many phone calls. I could not handle the phone calls, and that was where I decided, okay, I need to hire someone to get my phone calls.
Mhm.
I didn't need her to check in a person, check their vitals, just pick up my phone calls. That's how it began. But at this point, I couldn't handle the day without a staff. I mean, I could if I really, really wanted to, but it would be very difficult.
Sure. And in terms of your staff person, what are the duties that they help out with on an everyday basis?
My staff is multitasking, right? So my staff also, does the front desk. checks in a person, just a very basic vital, but, picks up all the phone calls and faxes, really answers all the questions that sometimes patients have. They work as my right hand. So like I tell them, if you could do me something called here referral wise too, right? To contact the offices, they do all that. And it's only been positive.
And how did you find this person?
I think I applied for Indeed, and I looked down through Indeed. That's how I found our first medical assistant. And then after that, what was very interesting was I got the person who was hired. She actually went to a medical assistant school that happened to be very close to my office. So she told me about her school. So I don't know why I contacted that school, but I contacted that school and mentioned that I have a medical practice and your student is currently my staff. They kind of gave me an idea. Would you like to would you like to help train a medical assistant?
Wow.
So I said, sure, we can try it out. So we got a student, but in that transition, they said, do you also need another staff right now? So we said, yes. So we hire someone and we have sort of like a program where we have a medical assistant students coming through our clinic.
That's awesome.
So,
And I
yes.
think that's great, because as people have talked about having medical students and residents in their clinics to have them learn about DPC, I think that's really great for medical assistants in your area, learning about what direct primary care is and how it's different, because there's other DPCs in your area that they could potentially work with or help support, and they would already understand the model because of learning in your space. So I think that's super powerful to help grow your guys' local ecosystem.
Yes.
And I want to ask here, when you think about, there, like you said, there's listening to this podcast, there's lots of people at different stages in their business ownership, but what are some of the questions that you wished others would ask themselves if they're thinking about DPC?
If they're early on and let's say they haven't opened the practice and they'll be asking questions, they really have to know why they're wanting to open a direct primary care office. It is a lot of hard work. It takes time, but you have to know what you're looking for. And if this is a solution, then I think direct primary care is a great option. Even after you open a direct primary care, like myself, I've been in it for 3 years. There will be different questions that come out in different stages of your transitioning. And like right now, I can tell you that 3 years out, I have a full panel somewhat. I mean, I could take more patients, but I'm at a point where I want to open my aesthetic practice. And you come to a question like, do I need to hire a staff, like a provider at this point to take on new patients while I'm doing this aesthetic? And you really have to kind of evaluate where you are. And I think that happens in different stages of your, business.
Awesome. I want to ask about the fact that you also have 2 young children. And so when you have a practice of 400 people, you are about to branch into another arm of your DPC into aesthetics. I want to ask how are things going with regards to balancing your kids' schedules as well as your own schedule and your husband's schedule?
Yeah, so I think that's a great question. Like, for example, uh, other direct primary care doctors, I think everybody's different. They may be only seeing like 5 people a day, 7 people a day, but not every direct primary care will be seeing that few patients. It depends on how that person practices. And I'm a person who sees a lot of patients in a given day because I just like to follow up. And even though I am having a direct primary care, which has been really helpful for me in terms of scheduling, like making my own schedule, it's still been a struggle for me to kind of balance taking care of my 5 and 7-year-old children with working and in the verge of opening an aesthetic practice. So it's been great, but I think for everybody, they have to make their own decisions how to run the business, because even in direct primary care, you could be overwhelmed. And you have to make the right decision so that you're not going to be burned out, even in direct primary care.
Such an important thing to point out. And I want to ask there one last question in terms of when you have reached those points where you're like, oh boy, I'm feeling it. This is getting a little stressful. What do you do to get through those moments as an entrepreneur and a mom and a physician?
I really just kind of ask myself, what is it that I want to accomplish? Like, and I kind of go back and decide why I made this transition. So if I'm gonna have to take some time doing something, I just pause. And that's why I have a waiting list going in my clinic. And by the way, that's been great for me for my business, because somehow once I started the waiting list, there's a lot of people calling. But you just have to like pause and take a step back, because in the early part of my business, like when anybody calls and inquire about the business, I'm just so busy just taking them in. But at this point, I really have to take a pause because I need the time to do something else, which could be more important. So you just have to make the right decisions.
And for those people who are thinking about doing DPC, what words would you say to them based on your experience?
I want to say, from my experience, it has worked out for me greatly much to have a low scale, like, low budget, low overhead start. And that has really alleviated a lot of the stress, because it took time. It took years for this to grow. I mean, 3 years, it could sound very short time, but it was a very long time for me, where in the first even a year and a half, I think I mentioned to you, I had a lot of doubts about myself, doubts about the practice and about myself. There were many times where I felt like I should just quit this and just go back to get hired somewhere. So I think that you really have to make the right decision, and, not to get distracted. Not having so much of the overhead and the financial burden has really helped me, because I could kind of forget about that part and worry about other issues. But if I was really burdened financially, it would have been very difficult for me to get through that stage.
And definitely, if people are in that boat of being concerned about the finances, those are the questions that I would, think about in terms of bringing to the DPC Summit in Kansas City or the Hint Summit in Denver. Because when you think about what is your why, like you said, and then you think about the things that are making you hesitant to do DPC, even though it's consistent with your why, that's where I would narrow down your questions when you're networking with people in person or reaching out to other people who are doing DPC like yourself, who have been in practice for years and who, know the ups and downs, the ebbs and the flows of these practices. So thank you so much, Dr. Lee, for joining us today.
Thank you so much for having me. It was really wonderful.
Awesome. And I hope to see you soon at one of the summits.
Yes, we will.